So it's Sunday, 7th of November, 5:45. I was consulting Dr. Google, which you should never do, about excessive urination and excessive thirst, frequent urination. And I found this official looking thing from the UK's nice.org.uk. How nice of them. So I've been off the medication since 9 p.m. last night. It's nearly 6 a.m. and things are progressively deteriorating. Got the shakes. So, as we know, Parkinson's has both motor and non-motor components. One of the non-motor components is progressive, is aspects relating to the digestion and the autonomic system. Specifically, in my case, frequent urination, as alluded to earlier. Didn't want to say it, but you got to face it. So what I found, it says, when should I suspect end-stage Parkinson's disease? Suspect the person has end-stage Parkinson's disease with a probable life expectancy of 6 to 12 months. If they have severe progressive worsening motor skills and complications, such as increasing off periods, check. Dyskinesia, not sure what that is. Mobility problems, little bit. And falls, no. So early end stage. Second, severe progressive worsening of non-motor symptoms and complications, including worsening cognitive function, depression, anxiety, hallucination, and or delusions. Yeah, a little bit from all of those. I think my cognitive function is declining. I don't really feel the depression, but that's probably the Parkinson's masking. I've certainly had anxiety, hallucinations and or delusions. I had some earlier, but they faded away. Symptoms which show a decreasing response to anti-Parkinsonian medication or an increasingly complex regime of anti-Parkinsonian medication is needed. Yes, the Matapar just wasn't doing it for me. Declining physical functioning and an increasing need for support. Limited self-care. In bed or chair over 50% of the day. That's my work. I'm sitting in a chair all the time. Maybe I have to stand more. Repeated unplanned or crisis hospital admissions. Yeah, that's happening. Oh yeah, here's a good one. Low BMI or significant weight loss. For example, more than 10% weight loss in the past 6 months. In my case, 19 kilos in the past 8 months, 10 months. Dysphagia leading to recurrent aspiration, pneumonia, sepsis, breathlessness, or respiratory failure. Not so far. Speech problems causing progressive difficulty communicating and or progressive dysphagia. Not that I've noticed, maybe you will. Significant comorbidities. Yeah, other things are happening. Checking them out. For people with end-stage Parkinson's disease, the focus is on palliative care to relieve symptoms and improve quality of life. Now, one of the key quality of life measures is, can I manage on the medication? I think that's why I really need the DBS to help me be less reliant on the medication. But of course, I'm not a doctor. I'm using Dr. Google. This may not be quite as bleak as it looks. End stage Parkinson's. Maybe it's the diagnosis, maybe it's not. But I need to consult professionals. Maybe get some counselling. Maybe think about writing a will. I've already started. Maybe a living will. And yeah, they actually have some recommendations. Liaise with the specialist team and Parkinson's nurse to ensure their anti-Parkinsonian medication is optimal, and to coordinate support and advice from other members of the multidisciplinary team, such as community nursing, where's that palliative care team, occupational therapy, physiotherapy, dietetics, and adult social care as needed. Let's see what Kensington offers. Ensure continuity of care whenever possible, for example, by having a nominated named GP. I was in the GP last week for a flu shot, and he said, "We could get you a named GP." And I thought, that's nice. Where'd that come from? Now I suspect I know. Other discussion of end-of-life issues, such as the disease process, possible treatments, what dying might be like, and how symptoms can be managed. Ensure the person has an advanced care plan. I better do that. And discuss any advanced decisions they have. Yeah, need to do that. Opportunities to discuss or review an advanced care plan and discuss end-of-life issues can arise when there is a clinical event or deterioration, or when there is a change in social circumstances, such as a move into a care home. Other information about lasting power of attorney for finance and/or health and social function, social care future decisions. Consider withdrawing non-essential medication following special advice. Yeah, let's not go there. It's not quite there yet. A little bit of constipation. I'm still walking every day. Well, maybe a few days I didn't. That's our little secret, okay? Uh, time to pee.